Hello everyone, I am Dhruvisha, an intern of SMBT Dental College, Ramangaon. I welcome you all to yet another Instagram live session of the Dentistry and Beyond campaign and wish you all a very good morning. So today we are going to have Dr. Mayur Davda with us. So before that, let's speak something about Dentistry and Beyond. So, Dentistry and Beyond was initiated with an aim to inform people about the future scopes, opportunities, advances, etc. in dentistry by connecting to various experts and professors in this field. All the live sessions that we have conducted till now were to tell people that what all revolves around dentistry and what all different arenas are there that people can take up after completing their bachelor's. So today we are going to welcome Dr. Mayur Davda sir, and he is going to speak about Dental Photography 101, a beginner's guide to documentation. Let's speak about dental photography a bit. So we all are taught to do exceptional work in our dental clinics to record to record some cases that we do the before and after pictures. So it becomes very important to have those pictures for our future reference. And also, if we want to publish any article, will require very good pictures. So for that purpose, we also need some skills to take the pictures very nicely, the alignment, distance, height, and everything, the amount of flash that we put. So that is also an art. And to learn that, sir is going to teach us about perfect dental photography. He'll also speak about mobile dental photography and the one using DSLR, the differences and everything. So if you all have any questions regarding the same, you all can start posting. And yes, case documentation has become a really very important thing these days because publishing an article really requires good pictures. So we hope that we learn a lot of things today from the master himself. So without any further delay, let's connect with our today's guest speaker. Good morning, sir.
Hi, good morning.
I hope, sir, you're doing well. This is Dhruvisha, an intern from SMBT Dental College, Ramangaon. And sir, I welcome you on the behalf of SMBT Institutes to the Dentistry and Beyond campaign. Thank you so much, sir, for sparing your valuable time on this Sunday morning. So, before we start with the session, I would not like to miss this opportunity and honor to introduce sir to everyone. However, sir is very well known in the dental fraternity. I would like to take this chance to introduce him today. So, Dr. Mayur Davda sir is an alumnus of Dr. D.Y. Patil Dental School, and he also has his private practice in Mumbai since 2010. He's the founder of the only institute for training and research on dental photography in India. He has also received Best Dental Photographer of the Year award by the IHP in 2017-18. He was also awarded as the Best Dental Talent of the Year in 2015. Sir has also delivered various lectures on podiums, to name few, FAMDent, the World Dental Congress, Smile Summit, etc. He has also exhibited his splash photography in various festivals which are well known in the world. To name few, the Jahangir Art Gallery in Mumbai, the Kalagoda Art Festival in Mumbai, the Taj Literature in Delhi. Sir has also delivered many hands-on courses in various top dental colleges. The list is endless, but I would like to name a few. For example, the Maulana Azad Dental Institutes in Delhi, GDC Mumbai, Ahmedabad, then Manipal University, Manipal and Mangalore, both. There are so many, the list is endless, but yes, Sir has marked his presence everywhere with his great work. And also, Sir has been the judge at the photo marathon. He has also been interviewed on national television twice and was invited by the Consulate General of Turkey himself. Sir has many publications under his name. So everyone, here we have with us the dentist, pro photographer, YouTuber, blogger, a web designer, content creator, social media marketer, and an influencer with us, Dr. Mayur Davda, sir, everyone. Over to you, sir.
Hi, everyone. Thanks for handing me the mic. Right, so we have around 44 people with us. Um, can
Yes,
you
sir.
give me a brief about who these people are who are joining us?
Yes, sir. The people who are joining us today are the undergraduates from SMBT Dhamanga and Samnamne, the interns, the passed out alumni, and also a few of the faculty members.
Okay, okay. All right, so I'm going to be speaking about dental photography. This is the first time when I won't be having any presentation as such. So, how do you usually do it without a presentation, right?
So usually we keep a question answer round where we shortlist all the questions that we have received from the students. The most common ones we shortlist them, and then I ask the question to the speaker, and then they just answer according to their knowledge on the question.
Oh, so you have questions already?
Yes, sir. Actually, we had opened a panel for questions, and we have received many questions. So we shortlisted the most common ones, and we have come down to 5 questions which were most relevant and most commonly asked.
5 questions.
Yes, sir.
All right, let's go ahead. So, you want to start asking the questions? I'll answer them. No problem.
No problem, sir. So the first question we have received is, sir, is mobile dental photography enough for documentation?
Uh, can you quantify the term enough?
So actually, in the college, we students, when we do any case, for example, recently we did laser pigmentation surgery, gingival pigmentation surgery. So at that moment, we didn't have any cameras, the DSLR ones. So we just use our mobile phones and we try to capture the best outcome. So is mobile enough to capture the best work we provide to the patient, or do we really require a DSLR?
Okay, so you are a PG student?
No, so I am an intern.
You are an intern. Okay. If if phone was enough, then nobody in the world would be buying a DSLR, nor would anybody be talking about it. So there is no way in which phone can live up to what a DSLR can provide. Very honestly, so that is loud and clear. But it's not that you cannot use your phone. You can use your phone until and unless it's not about publishing it. It is okay to educate your patients and show it to your patients, because patients are not going to understand what is distortion. They're not really bothered about image quality mostly, I think. So I would say that phone is adequate till the time it's not about publication and it's only restricted to patient education. And it's okay if you are a little unprofessional looking, but if you want to look professional, if you've done really great work, uh, and if you want to really show it that you have done great work, then you need to document it with a professional camera, because only that will show you how good a work you have done. The phone will not live up to your expectation. Most of the time it will be like, I'll tell you very honestly, and this is not my experience, this is what the PG students in other colleges have told me. They have told me that they are really good at their work, but when they take pictures with their phone, it does not justify how good work they have done.
Well,
So this part will always be there when you are documenting with a phone. That goes without saying. So the choice is yours. DSLR has a learning curve. It may sound expensive, but it's not expensive because it's just a one-time investment. And on the other hand, phone does not have a learning curve, of course. You can just point and shoot. It's ready to shoot. You already know it. And it comes for free basically. You're buying a communicating equipment and the camera comes for free. So there's no investment per se. So you can say that phone is just easy to use, but of course you cannot talk about it
give the
being
best.
enough. Enough is a very subjective term. For me, enough means perfect. I don't know if enough, what is enough for you. Maybe for some students, enough means just to educate the patient and to do their routine work. In that case, the phone is enough, yes. But for me, I'm very particular about, very meticulous about my work. Um, I like to see my mistakes live. So we all have to accept that we all make mistakes. Even I make mistakes clinically, even today. So when I'm doing my treatment, so many times, even with the loops, I cannot see my mistakes. So I have a DSLR, which is the model number is 6D. It's a professional camera. It's also got as a full frame camera. But nowadays, every camera has Wi-Fi. Every DSLR has Wi-Fi. So as soon as you take a picture, you can see it on a bigger screen. So for me, when I am taking pictures, it's showing me my mistakes in detail. That is one of my primary requirements, and it is where the mobile phone fails very badly, because when you blow it up like this, you cannot
with
actually
the
see your mistakes. So for me, it's not enough, but maybe for somebody else, it's enough. So enough, it's a very subjective term. And to in a private clinic, very honestly, your situation is different. You're an intern. I am not an intern. I have my private practice. So when you take a picture with a phone and show it to your patient, it looks very unprofessional, in my opinion. Um, because even they know that it's not a documentation equipment, that's a communication equipment. Uh, Maybe in your college you are okay, you are safe. Maybe you are in a two-tier city. Maybe that is why also it's safe. But in places like Mumbai and in a private practice, especially, I don't think the patient will appreciate that you are touching your phone when you are documenting your case. So it's subjective. Enough is a very subjective term, even with respect to the city that you live in. It's actually with respect to the practice. If you are into mass practice, anything is fine. And you also know it. In a mass practice, no matter what you do is enough, because it's not a
yes,
class practice, it's a mass practice. So in a mass practice, using phone is enough. But if you are into quality treatment, if you want to present it properly, if you want to publish it, if you want to be presentable in front of the patient, if you want to be ethical, you have to have a DSLR. But when it comes to a student, I can say maybe for an intern, phone is enough. Maybe. But you should also know how to use the phone. I have seen a lot of interns who don't know how to use it. Maybe they think that it's just like general photography, but it's not. You have a technique even in a phone. Yeah.
yeah. So actually, so we are in the process of learning also from using a DSLR. So because there are many students and many cases going on. So at times we don't have a camera with us, so we tend to take it with the phone itself. So yes, but yes, the sir has really answered it very well. If you want to document your case, you really need a DSLR to justify your work. Otherwise, mobile phones are enough to educate the patient or just to keep a record for yourself. So thank you so much, sir, for answering the question. And so moving on to the next question. Sir, how difficult is documentation using a DSLR?
It's very easy.
Okay.
Yeah, it's
So,
very
sir, the
easy to
advantages
document.
and disadvantages.
Uh, okay. I will answer it in a very relative way for all the students. Um,
Yes, sir.
have you ever used an endomotor as an intern? I don't know if you have used an endomotor.
So, can you come again? I
Have you
actually
used
was
have you
unprepared.
used an endomotor? Endomotor.
Endomotor, yes, so we recently had a workshop. So, we did use an endomotor.
Okay, so basically, you cannot ask if using endomotor is easy, right? Because it depends upon the
Yes,
person who is using it.
using it.
For a person who knows how to use it, it's easy.
Yes.
And for a person who does not know how to use it, they feel hand filing is better than endomotor. I hope that answers the question, because an equipment is only as good as the person who is behind it. And that goes for any equipment. It's not only for a DSLR. It could be for a microscope, it could be for a 3D printer, or it could be like an intraoral scanner or a milling machine, like CAD CAM. A designer who's good at CAD CAM can do the work efficiently as compared to a dentist who is learning it. But basically, if you follow all the rules, it's very, very, very easy to use a DSLR. In fact, it's way more easy as compared to a phone. The problem is people buy a DSLR thinking that they know it, but a dentist uses a DSLR in a completely different way as compared to a general person. A DSLR is actually made for a general person, but a dentist has learned to accommodate it in his professional life. But we have a completely different technique of using it. The ways in which we are completely different is we use completely different settings as compared to a general person. We use completely different settings in terms of depth of field. For people who are listening, I think we have 40 people live. People who understand what is depth of field, they should be knowing what controls depth of field. So there's a setting called F number that controls depth of field. On the phone, F number is fixed. So that is the
Yes.
drawback of a phone. But on a DSLR, you can go as high as F22 or even higher. That's the biggest advantage of using a DSLR. So I would say that it's very easy to use a DSLR provided you know what settings are to be kept. Don't use a DSLR like a general person. It's not supposed to be used like a general person because our settings are very, very different, especially when it
Mhm.
comes to F number or depth of field. And the biggest mistakes that a lot of students who also have a DSLR do is that they use your lens on autofocus. We are not supposed to use our lens on autofocus.
Okay, so here's a big tip coming from sir that we should keep in mind in future when we are documenting any case. And also, I believe that everything has its first time. So if we start using it once, we know the correct way of using it, then anyone can use it very well. If I'm not wrong.
You should have the right lens also.
Yes, sir. I agree.
So maybe maybe there must be students who have 1855 lens on their DSLR. They can maybe use it on autofocus. Um, but ideally you're supposed to have a 100 mm macro lens. Very honestly, you're not
So then,
supposed to
which
use 18.
mode should we use if it's not the autofocus mode?
I'm sorry.
So then, which mode should we keep the camera on if we are not supposed to keep it on the auto mode?
I'm not talking about the camera mode, Dhruvi.
So
I'm
then,
talking
which
about the
then?
autofocus lens.
Autofocus. Okay.
Yeah, the lens should not be on autofocus. The lens
Okay.
should be on manual focus. So there are only two modes on the lens, auto and manual. I'm talking about the
Okay.
lens, not the
All
camera.
right. So it should be on the manual mode.
Manual focus, yeah, yeah.
Manual
And
focus.
if you're asking me about the camera mode, then it should again be on M, which is manual.
All right. Sir. Thank you so much, sir,
Yeah,
for this
but
great tip.
I don't know. I mean, you should have some basic understanding of DSLR before you try to put it on manual mode of the camera. So that's where the learning curve comes in. But there are tons of videos on my YouTube channel which are available for free. So I have a YouTube channel called Dental Photography School where I've spoken a lot about camera settings. So maybe just they can just go through that once and then probably keep the camera on manual mode. But I was talking about the manual focus on the lens actually.
Okay, sir. So everyone, if you want to really learn the settings very well before clicking the pictures, you can really go through towards YouTube channel Dental Photography School. So you will get to know much about it. Thank you so much, sir, for answering this question. So we would like to move on the third question. So this question is from a faculty member. Sir has asked, we all have read dentistry is an art and science. Does good documentation in highlighting artistic dental work that we perform helps us?
Yeah, it does. Because okay, very honestly, just doing documentation for a case becomes very, very monotonous. Because we have very, very particular rules to document a particular picture. Uh, and you keep on repeating those pictures, and you do get very, very bored after documenting that same picture over a period of time. That's when artistic picture comes in. So first of all, let's try and understand, what do you understand by artistic pictures. Artistic
Yes.
pictures could be pictures taken with a different light source called studio lights, or very eccentric angles. They are not the routine angles. They are not a part of any documentation protocol, but it shows you the way you're using your equipment properly, or maybe your tooth preparation in an artistic way. So to be very honest, any picture can give you some information. Even a bad picture can give you some information. So artistic
Yes.
pictures also have their role to play in dentistry. They will glamorize your work. That is number one. And number two is they'll help you promote your private practice in platforms like Instagram and other social media platforms. And of course, you can use it on your website. So I've seen a lot of dentists promoting treatments like teeth whitening, laminates, and veneers with stock photos. Stock photos means pictures that they've purchased from Image Stock or Shutterstock. These are websites where you can purchase images. Or there are some dentists who just download it by Googling it, which is absolutely wrong. So, artistic pictures can help you promote your own private practice by using them on Instagram, on your own website, rather than downloading it from Google or buying it from Image Stock and Shutterstock. And I'm not really sure if you are aware, but I come up with a dental photography calendar every year. So a lot of dentists, they send their entries from across the globe, and they are all about artistic pictures only. They are not the typical boring documentation pictures. So if you are good with artistic pictures, it can get printed on something really beautiful. You can print it and put it on your clinic so that it inspires you every day. It can come on a dental photography calendar. There are many uses of even artistic pictures. So you should incorporate it in your private practice as well. I I do a bit of both every time I do a particular case. Yeah.
Right. Thank you, sir, for letting us know the difference that lies in artistic dental photography. And I hope the question was answered. And yes, thank you, sir, for this question. And sir, we would like to move on the next question. Sir, is clinical photography important?
I'm sorry, can you come again?
Yes, sir. Sir, is clinical photography important?
Of course, it's important. It's very, very important for many reasons. Number one, it's important to see your own mistakes. So it's important for self analysis. Then you can educate your patients. That is also why clinical photography is important. Um, Many times I give this example in my private courses. I do private courses almost every month. It's a 3 day program. But on the first day, I always try to inculcate that clinical photography is very important in many ways. It has more than 50 applications in dentistry. The most important thing for me, why clinical photography is important, is because I can see my mistakes and where I'm going wrong. So it makes me a way better clinician when I'm documenting my cases. So you have to do photography, even if your work is good or bad. It does not matter. Document everything. When you see those pictures again, automatically you will feel that you can improve your work in any particular step. So you have to take pictures stepwise. That means there is a lot of intraoperative photography also that has to be done. Then when you record, so basically clinical photography talks about protocols. So if you have an anti-aesthetic case, we have a set protocol for 12 pictures. Why we have 12 pictures is because we can see our case from different angles, because every angle will show you where an improvement is required. So clinical photography, if you know it correctly, it will help you see your patients in more number of ways, which will help you give them better treatment, because you can thoroughly analyze the case properly before you do anything with that particular case. So it's helpful in diagnosis, it's helpful in treatment planning, it'll help you a better clinician. It will help you educate your patients also. For example, I was telling you that I give this example in every private workshop of mine. Whenever I start a particular case, I take a preoperative picture, but before I touch the bore, also I tell the patient what the treatment planning is. For example, if the patient has come to me for a simple cavity in 4-6, but it's a borderline case, it can go into a root canal, it can be direct pulp capping, indirect pulp capping, or maybe just a normal filling. On the X-ray, it's looking like a borderline case. So I try to explain it to the patient that this is a borderline case. And when I start excavating, I keep on taking pictures so that I'm not, the patient is not, just blindly trusting me. I'm showing the patient what I'm doing so the patient can visually see what's actually going on. They can completely trust me as a dentist, which is what is the need of the hour. Um, Somewhere down the line, I think that the patients are losing trust on doctors because of a lot of things going on in the hospitals. So when you become transparent and show them stepwise procedures and show them stepwise pictures, like okay, now you can see that I'm approaching the pulp, or you can show that pinpoint exposure. At when I show it, so I show it to them. There's a very good isolation. I tell them, see, there's a very small pinpoint exposure. I can probably think about doing a direct pulp capping. Let us see if it's successful. Maximum what can happen is you will have a lot of pain, and then we'll go for a root canal. So you can give the patients on the spot treatment options if you have some backup supporting you, which the patient which will not like if you're not showing them the pictures. For me, I have a backup. I'm showing them the pictures and I can give them on the spot treatment options. But for a person, for a dentist who is not giving on the spot, who's not taking pictures, and you've already committed to some kind of treatment beforehand, you have to do that treatment because you committed to that treatment plan. But for me, I can change it. I There are cases in which I've told the patient upfront that this is a root canal. I will do a root canal. But while taking pictures, I'm telling the patient, oh, I don't think this can go. I think I have a chance to save it. Do you want me to save it? And the patient is very happy because the patient is saving money. But there are cases in which I have told the patient that this is a filling, but then there is some bleeding, unfortunately, and I tell the patient that if the bleeding is very profuse and is more than 2 millimeters, I have to start with a root canal. But the patient is completely open-minded with me because I am literally showing them what's going on live. So the trust factor when it comes when you're showing the pictures with me is completely different as compared to a dentist who is not showing them pictures. That is very, very different. That's very, very important. So I feel clinical photography is important, not only pre or post op, but even intraoperative pictures because you can explain the treatment plan so much better to the patient as compared to people who are not taking pictures. But of course, if you are showing pictures, you have to be very meticulous. Um, uh, because I'm showing pictures, I have to do very good isolation. I cannot, I cannot be careless. So that is also one advantage. So many patients who come to me, they have never experienced a rubber dam, but I don't do anything without a rubber dam. So the patients are inquisitive to know what the hell is a rubber dam. So I show them what is a rubber dam, and then some patients are comfortable. Let me be honest. Some patients say that I don't want a rubber dam. So I tell them, I'm sorry, I don't do anything without a rubber dam. So I will not be able to take up your case. So you have to let some patients go. Some patients will stay. There'll be some patients who will come next time and say that they want a rubber dam. That is the difference that you will make with the pictures. So you have to educate them and get them to a better level of treatment. Okay. That is very, very important. You have to educate your patients if you want to level up the dentistry in India. See, other countries, there's already a lot of awareness about dental procedures because they are taking dental pictures. Everybody's using a DSLR. Let me tell you, even the ceramists are using DSLRs. But in our country, dentists only are not using it. But now the topography is changing. I have had so many ceramists who have also come for my course. There are first year BDS students who are joining my course, which is I'm very proud of them. So that topography is changing very fast. And because in these beginning years, first year, second year, third year, final year, you have a lot of time to do, I mean, time to learn this art and science as compared to when you are an intern, maybe. Because when you are an intern, you are more inclined to do clinical work.
Yes, sir.
And mind you, even when you are an intern, I think you should record your pictures because so currently I'm looking for a person who has to come to my clinic. I'm looking for somebody who can handle my clinic. So in the portfolio itself, I have mentioned that I want to see your cases before I invite somebody for a job. Before I hire somebody for a job, I want to see their cases because that those cases will help me decide their salary. And if you've not recorded any cases, I'm going to tell you you work like 1 month. I'll let me see your work and then I'll decide your salary. But if you already have your work and I see that you're using rubber dam, I can offer you a salary on the table, which is a very big difference as compared to a person who is not doing clinical photography. So basically, clinical photography has tons of applications. You need to do clinical photography pre or post op, even intraoperative. Even if you're doing bad work, record it. Because if you show your bad work, also, I think there'll be people who will be still supporting you. They'll tell you how to come out of a difficult situation. So there's no harm. Everybody does mistakes. Record your mistakes also so that you can learn from them. So that is what I wanted to say.
So, sir, it's about patient education, gaining their confidence, and also to know where you need an improvement. So, clinical photography really plays a pivotal role, and it's
For
gives
everyone.
many opportunities. Yes. So, sir, we have one live question popping up over here. The person is asking, sir, can you speak about cross contamination that happens while taking the pictures? For example, you're
Uh,
doing any and then
yeah. So
you decide.
so the person who is asking this, I want you to check out a video on my YouTube. I specifically made a video for this. It's called "How to Maintain Asepsis During Surgical Procedures." It's one of the most popular videos on my YouTube channel, in which I've shown you how to cover your camera equipment with sterile gloves so that there is no cross contamination. So do check out this video. It's called "How to Maintain Asepsis During Surgical Cases." It'll solve your doubts.
On dental photography school page on YouTube.
Dental photography channel on YouTube. Yeah.
And so the next question that we have is, sir, what are your tips
Dr.
for fresh
Preeti, I
past?
know my voice is low because my throat is really hurting. I'm really trying my best to be as loud as possible, but I think this is the max
So
that I.
that's grateful for you. Grateful
Otherwise,
for
I'll have
you
to keep
for
it like this,
coming.
and you'll not be able to see my face. You decide how you want it.
So you're audible enough. But yes, so thank you so much. Despite of having a bad throat, you're here today with us. So thank you so much for that.
It's my fault. I had a lot of cold drinks,
So it's not your fault. It's summer, so
and
we are
actually, I
bound to do
was
that.
in Nepal, and maybe it's really cold there.
Okay. So, sir, the last question that we have today is, so what are your tips for fresh pass out dentists regarding documenting their work?
Yeah, Dhruv is not audible. Even I agree. I
I'm not
also have to
audible.
like listen carefully what she's asking me because it's very difficult to listen to what she's saying.
Sir,
It's not
I'll
me
try
who's not
better.
audible, it's you who's not audible. Speak
Am I
loudly,
audible now?
maybe.
Am I audible now?
Oh, what's the point? We are almost ending this live. Now you're audible. Yeah.
Sir, but I suppose I was audible enough to you before to all
I
the
was
questions
listening
to you.
very carefully the questions so that I can answer it properly.
You
But
could have
anyways,
informed me earlier.
I'm the person who's speaking maximum, so it's completely fine.
All right, I'll try speaking a bit louder. So, sir, what are your tips for fresh pass out dentists regarding documenting their work?
I think I already answered that, right? Please document everything. It does not matter if you're fresh or not. But yeah, if you're fresh, um, dentists outside who want to hire you, they're not going to trust you just because of your looks or how presentable you are. Yes, that does matter. Soft skills matter, your looks matter, your personality matters. But if you come to my clinic, I'm not going to be hiring you for how you look or how you speak. I am a person who travels a lot and who's going to give you my cases, right? And my cases are very important because my patients are very important for me. And if I have to trust you with my patients, I have to make sure that you are capable of that. And if you want me to give you a job, you have to show me that you have done good work. And if you can't prove that to me, why should I hire anybody? So please document all your cases nicely. It'll help you in your post graduation days also. If you're fresh pass out, and if you're giving your NEET also, probably if you get into PG is the time when you should record maximum cases. Although I know that it's very difficult for a PG to document because there is a hell lot of work to do in their day-to-day life. But please document your cases even during PG. So if you learn it during your fresh pass out years, it's going to be very easy to apply that knowledge during your post graduation days. So at least before entering into PG, that is one tip that I would want to really personally give from the bottom of my heart. Before joining PG, at least learn dental photography properly so that during the post graduation time, if you have good cases, you should be capable of publishing them at a very good level, and you can do good presentations, poster presentations. That is why fresh pass outs can also build their CV up. Okay. So when you show me your CV, I'm going to have a look at how many competitions you've participated, how many paper presentations, how many publications you have. So if you've not documented only nicely, how are you planning to publish it so well? Like your article has to be interesting, yes, but it should be supported with some kind of clinical photography or even in vitro or in vivo photography. I don't care about that. But even the articles are going to be requiring you to have some pictures. And that is where, for publication, for building up your CV, I think for fresh pass outs, it's very important for all these reasons. And if you want to get a good job, you should be documenting it properly to add into your CV. There's something called as case book. Maybe you can build up your case book so that it's like a PDF and you've done all your treatments in that if you're showing them. So you whenever you go to an interview, carry it along with you on your phone, and you can WhatsApp it to anybody who's asking for how your work is. So that's how it's going to be helping a fresher. But don't steal pictures from your friends. That's very, very unethical and very stupid. If you are taking somebody else's pictures and if you join my clinic, for example, I will realize on day one that you've really lied to me. I'm gonna throw you out the second day itself. I mean, if you're showing me something and if you're not living up to it, you think I'll not be able to find it out. It's not possible. It's very easy to find out. If you've shown me all your cases under a rubber dam, and if you are not even capable of selecting the right rubber dam for your patient, I think I've understood that you stolen pictures. So please document ethically. It does not matter if you use rubber dam or not. I mean, it matters, yes, but for a fresher, maybe it's not so important because maybe they don't teach it so well in colleges. But at least I need to see your clinical pictures. Anybody would want to see your clinical work before anything. If you are going into research work also, it's important. If you're going to publications, is important. If you're going into clinical practice, is important. So please document everything, good or bad. It does not matter. You have to record everything.
All right. So yes, there's a great advice coming from sir, and also stay authentic with the pictures you click. And yes, thank you so much, sir. So would you like to tell us something about your story? Like, how did you get into dental photography? You had an interest since your UG, or what provoked you to get into dental photography?
I was a jerk when I was a student. I I was really stupid when I was in college. In fact, I did not even want to join dentistry. I was very dumb in my 12th standard. I did not want to join clinical branch. But my brother did MBBS, and obviously there's peer pressure. If your elder brother has done MBBS from KEM and post graduation from AIMS, your family does expect something from you. Because he got into AIMS, I was like, fine, I'll do physiotherapy because you have to study the least in physiotherapy. But still, they forced me to go do dentistry because dentistry is a little better than physiotherapy, it seems. But during dentistry, I had no interest in documentation. I was not very keen. Yeah, but I used to do my work meticulously even when I was a student. And after I finished my BDS in 2007, I got my first DSLR. And I realized that clinical photography is very monotonous and very, very boring. And the other thing that I found out was I started my practice immediately, which was a very wrong decision. You should not join you should not start your private practice immediately. You should observe under someone for at least 1 or 2 years minimum, which I did not get an opportunity, and my family wanted me to start with my private practice. Because I started my private practice, I had a lot of time. I got a DSLR and went into wildlife photography. In wildlife, I did great. I had awesome publications in Lonely Planet and very good international magazines. Then I did my course in ornithology, that is to study birds. I did ornithology for 1 year, wherein I did scientific study about birds migration, um, ringing birds, catching the birds, counting their feathers, recording bird calls, all these things. And then I got too much into bird photography, macro wildlife photography. Then I did 1 year course in botany to understand the relationship between birds and plants and trees. But at that point of time, I realized that most of the people are doing wildlife photography because of Facebook Live, like, and Instagram, like. And it's not ethical to do wildlife photography unless and until you are doing some scientific research. Because when you're doing wildlife photography, especially macro, like uh, snakes and frogs and stuff, you need to move your specimen. So for that purpose, I stopped doing wildlife photography because it's unethical, and I started doing liquid droplet photography. I'm not really sure if I am audible because I can see that
Hello,
Dhruvi is. I cannot see your video. You're paused.
sir, can you hear me?
I can hear you, but your video is paused.
Okay, so yes, my video is paused, but sir, you are
Maybe.
very well audible to us.
And my video is fine.
You can continue. Sir, that's fine.
Okay, that's
So
good.
we can hear you. That's fine.
Yeah, so then I stopped doing wildlife completely after working so hard, and I entered into liquid splash photography. And in liquid splash photography, I did a great job um, in documenting splashes. Um, I basically take pictures of splashes. Because of that, I got an opportunity to exhibit at Kalagoda Art Festival. People, if there are people from Mumbai, do we have people from Mumbai in the audience? Just give
Many
me,
of them.
just give me a
In
thumbs
fact,
up.
our college is having 70% of the Mumbai crowd, the students.
They must be knowing Kalagoda Art Festival.
Yes, sir, very well.
Yeah, so I exhibited Kalagoda. Then people in Mumbai must also be knowing the Jahangir Art Gallery. It's a very, very respectable, one of the most respectable art galleries of the country, wherein
Yes,
to enter and to get selected into the Jahangir Art Gallery is also very, very tough. So I got selected in Jahangir Art Gallery. I finished exhibition over there. I was the judge for India's biggest photography competition. That's Photo Marathon, the prize of which is internship in Japan for 7 days in photography. So after reaching
it's
the
very
zenith of photography, like I had achieved whatever I wanted to achieve. when it came to photography. It was like the pinnacle of achievements. At that time, I realized that I think I should start teaching my colleagues. That's when dental photography school came in. I never learned photography from anyone. I have been self-taught. I made tons of mistakes because I'm into photography since the past 15 years now. So you say about a mistake, I have done that mistake. So I've done every kind of mistake, and that's why I think I'm very, very good at teaching. So I love to teach, and I know all the mistakes which are possible. So I think a person who has done all the mistakes is the best person to teach because he has screwed up big time and he knows where his audience can go wrong. That's the best teacher. And I like to also teach because I don't like to hide anything from anyone. If you're asking me a question, I'll tell you in detail about how you can get it a perfect shot. Because I believe that if I share it with you, it's going to be helpful for your friends also. So that's how I like to teach. I'm very open minded when it comes to teaching. So that's how it all started. The story of dental photography school started, and I started teaching the dentist. Now I've taught in many countries. I have a course almost every month. I go to tons of colleges and teach students, and it's a lot of fun. And who does not like to do photography?
True, sir. So, sir, it's an unquenchable desire, to learn and an urge to teach the young minds which have got you to the next level. And so we really respect the heart that you have with you and that you keep on sharing it with people. And we are really looking forward to meeting you in person and having a hands-on course real soon with SMBT Institutes. So
Yeah.
thank you so much, sir, for sparing your valuable time on a Sunday morning with us. You have truly enlightened us today with so many perspectives, your visions, your experiences. So yes, sir, thank you so much.
It was my pleasure. I'd like to thank SMBT Institute for inviting me over. I think I was contacted by Juhi Puri uh,
Yes,
from SMBT, so I want to thank her. I think she is doing oral surgery in.
yes, sir.
Yeah, yeah. So thanks to her, I could interact with you. I could get in touch with you. And I'm just hoping that this live could can inspire a lot of people to do photography daily. Just start doing it, even if you don't have a DSLR. Start using your phone. Just one important tip: when you're
Yes,
using phone for documenting your cases, start using autofocus lock feature. It's just a long press on your screen. That's very, very important. And for all your pictures, use flash. So if you're using your phone, always use flash, do autofocus lock, and do exposure compensation. So when you do a long press on your screen, and you use flash, many
yes,
times the pictures are very bright. But when you do a long press on the right hand side, there is a sun sign which will come. You can take that sun
yes,
sign down so that the picture looks dark. And when you use the flash, it will become a correct exposure. So that's the correct way of doing mobile dental photography in a nutshell. All the best to document all your cases, and
thank
I'll
you
see
so
you
much.
soon. Yeah,
Yes, sir. Thank you so much, sir. Have a great day.
you too. Bye bye.